If you've been told your knee pain, hip pain, back pain, or nerve problems are just part of getting older, today's show may completely change how you think about your body. What if your pain isn't coming from where it hurts? What if your diagnosis is technically correct but completely misses the cause? Today, I'm pulling back the curtain on the technology we use to measure what most healthcare systems never look for, why your body is breaking down in the first place. This isn't about treating symptoms, it's about identifying causes. Because when causes change, outcomes change. If you want help figuring out whether your problem is local or part of a bigger pattern, we built a simple root cause quiz. Just text the word root, ROOT, to 734-274-5107. That's our main office number in Ann Arbor, 734-274-5107, and save that number. Text the word root to that number. Or if you're watching online, you can click the link in the description below for the root cause quiz. Now, today's show is about cause, not symptoms, and the technology that lets us finally measure that cause. So most people we see in our office have done everything they were told to do. They're very, very good patients. They've stretched, they've exercised, they took the medications, they did the injections, they went to therapy. Some of them have even had the surgeries, and yet they're still in pain. This is not an effort problem. You've done plenty of effort and done a great job at that. But the problem is the system you're spending time with treats pain locations instead of patterns. And when you treat effects without identifying causes, you stay stuck. If you want to know whether your symptoms are effects or part of a bigger pattern, text the word root to 734-274-5107 and take the root cause quiz. You can also click the link below. I can't tell you in the almost 2 decades we've been in practice how many people have come in and have done everything. They've tried everything. They got the t-shirt for it. They were very compliant. They did the exercises. They went back. And they just never, ever, ever got lasting results. Well, the reason for that is because the cause was never addressed. Think about it. If your check engine light comes on and you don't address the cause of that, the light might keep coming on. Now, you can address the symptoms by putting tape over that check engine light, but that's not going to help you with the problem. I had a patient ask me just yesterday, hey, should I get cortisone injection in my shoulder blade where I'm having trouble? And the answer is, if you're looking for symptomatic relief only, then a cortisone shot can be very effective for that. If you're looking for why it's hurting in the first place, then a cortisone shot is going to cover those symptoms up and can create some long-term trouble later when it comes to the time to help the soft tissue heal. This is the Dr. Lazar show, and we're talking about cause and technology and what you can do to finally take control. And it starts with knowing what the root cause of your problem is, and we've put together a quiz that can help you with that. We'll be back right after this. Welcome back to the Dr. Lazar show. We're talking about local versus global problems in the body and how technology can actually help you determine the root cause. Let's talk about knee pain. Knee pain is not always a knee problem. Hip pain isn't always a hip problem. We routinely measure people carrying 30, 40, even 50 pounds more weight on one side of the body. That's huge. That kind of imbalance destroys joints over time. This isn't aging, guys. This isn't too many birthdays. This is physics. Think about this. If your body is distorted, your joints don't stand a chance. Think about this. If your car's out of alignment, is one tire going to break down, wear down faster than the other? Absolutely. You can get that tire replaced, but you're going to have to keep replacing it. Because if you don't address the fact that the car is out of alignment, it's going to keep repeating the problem. If you have a door that's on the hinges wrong, It's going to warp the door. It's not going to work properly. Your body is no different. Accidents and injuries tear loose the connective tissue that holds our spine together. Then our spine breaks down and locks in a stressed position, and it will stay that way until it's unlocked. It will not unlock itself against gravity. So there's a series of injuries and compensations that happen. When you're standing up, one hip might appear higher than the other at that point. If you look in pictures, you might see a shoulder lower than the other. Ladies, you might fix a bra strap the same side all the time because it's sliding down your shoulder. That tells you your posture is distorted and you are out of alignment. If you look at pictures and see one ear lower than the other, or that you have head tilt in your family pictures as you look back through those are very, very clear indications that your body is out of alignment. And so again, if your body is distorted, your joints don't stand a chance. When you're out of alignment like this, if you're on your back, one leg will appear shorter than the other. A lot of people know they have one leg shorter than the other. And unless you've had a hip replacement or broken your femur, the top bone in your leg, you very likely don't have a structural short leg. You have a functional or physiological short leg that can often be addressed. So we're talking about whether or not this is root cause or symptom management. And we've got a short quiz you can take if you want to see whether your body is balanced or distorted. Just text the word root, ROOT, to 734-274-5107, and we'll respond with that quiz. You can also click the link in the description below. Alignment matters, global versus local in terms of the body. That's a really, really big deal, and we're going to talk more about that throughout the show. This is the Dr. Lazar Show. Be right back. Welcome back to the Dr. Lazar Show. We're talking today about technology and how getting to the root cause of problems is really the key, the missing key that's been happening. And a lot of times, people wonder how we actually determine the real cause. Well, here's how we eliminate guessing. If someone comes in with knee pain and their posture and weight distribution are balanced, then the issue is likely localized to the knee. Maybe there was an injury right to the knee, and then it, started breaking down over time. That can happen. But if they're significantly shifted to one side, 30, 40, 50 pounds off center, then the knee pain is just the effect. And that's really important to understand. Because if somebody comes in and they're saying my knee hurts and I can't walk up and down the stairs like I used to, I guess I'm just getting older, and somebody does something, they treat the area of the knee. Maybe they get PT on the knee, or maybe they get injections in the knee, or maybe they take medication, they take ibuprofen or something. Well, first of all, the ibuprofen doesn't know that the knee is bothering you. It just kind of reduces inflammation systemically and blocks some of those pain receptors, but it doesn't know, it's not specific to the knee. So if somebody has that problem and they come in and their knee itself is being treated, what that will look like is the symptoms will maybe get better some, but they keep coming back. That's how you know you're not addressing the cause, is the symptoms keep coming back. They can come back on a smaller level. They can come back the same every time. They can get worse over time. But either way, if it's a problem that the body is broken down entirely, then treating the knee itself will not be effective. You've got to balance that weight out. But it's not one size fits all. That's why we have to measure. And we have technology that does that we're going to talk about in this show. So think about this. Treating effects never, ever, ever creates lasting results. If you're looking for lasting results, you have to find out why it's happening in the first place. You wouldn't call tech support for your computer every day with the same problem. You would eventually say, look, you've got to fix why this is happening. You would not put up with having to continually treat the symptoms of your computer not working. It doesn't work like that, and neither does your body. So the idea here is specificity beats strength every time. You hit somebody with a 2x4 hard enough, you're going to get some changes. But that's not what the body needs. It's got to be specific, and the body will react. It's very intelligent. The body will react appropriately. If you put an input in and your body doesn't like it or it's not addressing the cause, you're not going to get the results. So if you're not getting the results, change your method, change the way you're thinking about it. Don't keep doing the same thing. If you're getting some results, then keep doing that. You might get better results over time. But if you're not getting any results at all and there's not a good explanation for it, then you're not addressing it appropriately, and you're going to be frustrated. You're going to spend more money. You're going to take more time. Your quality of life is going to decline, and you're going to make it worse or impossible to fix as we go down the road. That's exactly what the root cause quiz helps uncover. If you want that quiz, it's free. Text the word root, ROOT, to 734-274-5107, or you can click the link in the description below. Hey, this is the Dr. Lazar Show. We're talking about how technology, specificity, getting to the root cause of the problem is what's been missing, and why your symptoms keep coming back no matter how much effort you put in, no matter how many visits you've been to, no matter how hard you've tried, no matter how many experts you've talked to. This is why the symptoms keep coming back. Now, one of the coolest pieces of technology we're the most proud of in our office, and I don't know anybody around that does this, that's what's super cool, is we do digital motion x-ray in the office. We literally are taking images of you moving. They just did a story about that in our social, so check out our social media. That's, I believe it's at lazarspinalcare.com. I think it's there, not my personal ones. But this is why static imaging fails. So you go in for x-rays and they'll take an image of you still. And we do those also, but we don't only use static imaging. Static imaging can tell us if there's a structural problem, but it doesn't tell us anything about the function of that area. So you can get static images of your spine. It can be helpful, but it's not the full picture. Your spine might have proper looking structure, but if it's not moving properly, you're going to have trouble. And MRI doesn't capture motion, CT doesn't capture motion, static x-ray doesn't capture motion. The only time somebody would have any motion studies outside of what we're doing is if they have something like video fluoroscopy done, but that's pretty invasive. They're injecting dyes into the body and they're, videoing. It can be very effective, but you're not going to do that unless you're facing surgery. That's a pretty invasive procedure. And so we do digital motion x-ray to see exactly how your spine is moving, which is so helpful because bodies don't break down standing still. Think about it. If you go, a lot of people that are having hip replacements will get x-rays taken with them lying on their back. Those are called recumbent x-rays. If you're lying on your back, you're not putting any weight in your pelvis and on your hips. So how your body is responding to that is a complete guessing game, because if you're getting x-rays lying down, that's not where you're putting pressure on your hip once you've had it replaced or if you need it replaced. So remember, bodies don't break down standing still. They break down in motion. Motion, motion, motion. That's what allows the body to break down. If your car wasn't in motion, the tire wouldn't break down no matter how misaligned it was. So the motion, while it's important, the motion is the culprit when alignment is off. And that's why so many people are told their imaging looks normal when they feel anything but normal. Your static images can be normal because your parts can be okay. But just because your parts are okay doesn't mean there's nothing wrong. If those parts aren't communicating properly with each other and the system doesn't have oversight and you're not moving properly and your organs, glands, tissues, and cells aren't communicating properly, then you're going to continue to break down. Instability is what creates degeneration. It's not your age. I promise you your problem is not that you've had too many birthdays. And here's how you know. Have you ever been told that your right knee is bone on bone? And you say, what about my left knee? They say, that one's fine. Your right knee is bone on bone. And you say, well, why is that? And they say, well, that happens with age. How much older is your right knee than your left knee? It's not any older. So the age is not the issue. The number of years you've been alive is not the issue. The number of years you've been out of alignment that leads to instability, and now you're moving and you're having progressive wear and tear on every joint in the body because of that abnormal motion. That instability is what creates the degeneration. You've heard degenerative disc disease. That's exactly what it is. It's a type of arthritis, but it's the wear and tear kind. It's not the age kind. Even though you're told it's an age thing, I promise you it's not. Damage comes from instability, not from movement. So here's what I mean. It sounds like I'm saying it out of both sides of my mouth. I'm saying that the misalignment without motion doesn't cause the trouble. That's true. The motion with the misalignment is what causes the trouble. But the misalignment with motion is what creates the instability. And that instability is where the damage comes from. So the movement is contributing to it, but the movement isn't the problem. Because you could stop moving today and still have a bunch of trouble. That's why when your activity levels change, at first you might notice differences, but eventually your activity levels can change. There's a young lady I'm talking to. She moves luggage for a major airline for a living. And she's in a ton of pain. She can't stand, she can't bend, she can't lift, she can't twist, she can't sit, she can't lie on her back, sides, or stomach. There is no position that's comfortable for her. So the first thing her doctor did was pull her from work. So now she's making a small percentage of what she was making because she's not working. And do you think she's feeling better because she's not working? No, she's not feeling any better. So we know it's not the movement that's the problem. We know the damage is coming from the instability. That's why we have to find the cause of it, and we have to address that. If you've been told everything looks fine, but you know it's not fine, text the word root to 734-274-5107, or if you're watching online, click the link in the description below. I'm Dr. Lazar. This is the Dr. Lazar Show. We're going to take a short break, and we'll be back right after this. Welcome back to the Dr. Lazar Show. So I'm an upper cervical chiropractor. That means I work at the top of the spine. I don't pop, crack, or twist the spine. Nobody on our team does that to get the results. The adjusting method we use, so the whole protocol is the Lazar method, but the adjusting method we use is a very precision type of adjusting. It's called quantum spinal mechanics. And it was developed by Dr. Russell Friedman. He's a mechanical engineer that became a chiropractor and realized that the body distorting is actually part of the picture. How the body responds to the misalignments under gravity is very, very relevant. So we're not just worried about the misalignments in the spine, and we're not just worried about the posture. We're actually worried about how those affect each other. And so as a chiropractor, I learned force-based adjustments, and I actually don't have any problem with those. When those are done properly, they can be very effective. That's not what we do, because we find that typically it's not a segment or two that's in the wrong place. It's the entire structure that's in the wrong place. And so what we find is that force-based adjustments focused on moving specific segments, and to the patient that can be that it's focused on noise. They're listening for that pop or that click or that thud sound to know if they got an adjustment. That actually has nothing to do with the adjustments, but it can still be effective, and people can really enjoy that. But what's different is with precision-based adjusting, we focus on neurological stability. The myofascial envelope, the fascia in the body, will know there's trouble long before the mind even realizes it. And so, is it bone out of place? Yes. Is it spine out of place? Yes. Is it neurological? Yes. Is it myofascial? Yes. So we can't address that separately. We actually have to have that be an all-encompassing situation to address it properly. And so the precision-based adjusting we do focuses on neurological stability. The nervous system is the control center of the body. And if we're not tapping into that, we'll never get effective results. So the goal is not just movement in the spine. Now, movement in the spine is extremely important. And when the spine moves, it tells the brain that things are okay. So we need the spine moving. But the goal isn't just movement, it's actually correct movement. That's the key. And so when the body is breaking down as a unit, we've got to restore that and restore balance. We've got to get you up and open. Gravity wins, guys. That's why grandma folds forward over the walker. You never see grandma or grandpa folding backwards. They fold forward. And so we've got to do something with that, because as gravity pushes on a misaligned structure, the movement is very, very, very abnormal. And it's that progressive wear and tear on every joint in the body because of the instability in different places. So the goal is not just movement. People say I need to move more. True. People say I'm going for this type of therapy because it helps me get that area moving. Okay, but the goal is correct movement. Whether you're getting adjusted, whether you're going to physical therapy, whether you're working with a strength and conditioning coach or a personal trainer, the whole power in working with a coach like that is to make sure that you're having correct movement. And so this is no different than that. So this is really, really important. If force fixed problems, athletes would never get hurt. Athletes apply so much force to their bodies. And if force could fix the problem, then they would never get hurt. But force doesn't fix the problem. You could argue force in the right place is going to be effective. And I would argue back that force in the right place, in the right direction, with the right depth is what matters. And that's completely true. If you want to find out whether your nervous system is stable or compensating, that's part of our root cause quiz. You can take that for free. Text the word root, R-O-O-T, to 734-274-5107, or follow the link in the description below. This is the Dr. Lazar Show. I'll be back right after this, and we'll discuss how high-intensity laser can help your body heal and restore. Welcome back to the Dr. Lazar Show. We're talking about how technology and addressing the root cause of the problem that you're having, is the key to winning at this. If you're sick of chasing symptoms, if you've been told everything is fine, if you are tired of telling your story over and over and over and over and over again, even though you feel like you're not being heard and you're just kind of being passed through and, having things thrown at it, but not actually getting results, this is absolutely the show for you, because we've got to understand what the root cause is, and then we have to apply the appropriate care to those root causes. So a lot of people ask me about red light therapy or low level laser. Very, very effective. That works at the surface level. And there are times that's exactly what we need. But chronic inflammation does not live at the surface of the body. It's much deeper than that. And so we have invested in and have used for a while a class 4 high intensity laser that actually delivers energy deep into tissues to 4 different depths. We use 4 different frequencies. And that's where real cellular repair occurs. Our laser targets water to push water out of the area to reduce the inflammation that's there by too much water being in the space. But it attracts red blood cells. So if it targets hemoglobin to attract those red blood cells, now you're getting the nutrients you need while not increasing the inflammation. Ice is a major problem when you put it on your body because it's reducing inflammation by restricting blood flow. But restricting blood flow is going to slow down the healing process or stop it altogether. So the laser splits the difference. It allows the red blood cells to come into the area, bringing oxygen and nutrients, which are extremely important, but it pushes water out so there's not as much inflammation. It also stimulates the production of cytochrome C oxidase, which is a catalyzer. It's rocket fuel, if you will, to the production of adenosine triphosphate, ATP, the fuel of the cells. Well, if you've got more fuel, your cells are going to heal much faster. And so high intensity laser is extremely effective. We had a guy come in, a furnace blew up, and he horribly burned, parts of his body. He was in the hospital. They were doing skin grafts and things. They told him how long it would take for him to heal. They told him months for it to heal. We did high intensity laser on him 3 times a week, and he healed 75% faster than the doctors told him in the hospital. It's very, very effective, and we've invested in that technology so you can get those results. We want you to be able to experience that where cellular repair occurs. Surface treatment cannot fix deep problems. If inflammation keeps coming back, you just keep having to take anti-inflammatories or do injections or stay on a low inflammatory diet because the inflammation keeps coming back. Text the word root to 734-274-5107 or follow the link in the description below, and you can take our free root cause quiz. I also want to talk about cellular repair signaling. We have a device called SoftWave tissue regenerative technology. Healing is not automatic. Now, the body does want to heal. So the initiating of the healing or starting the healing process is automatic, but healing itself is not automatic, especially as we get older, which is why a 4-year-old heals faster than a 40-year-old and a 40-year-old heals faster than an 80-year-old. Cells require the correct signal in order to repair, and those signals can change as there's interference over time in the nervous system, in how the body is functioning. Scar tissue forms when the signal is wrong. So when we have the correct signal coming through the body for healing, it will heal correctly. But when that signal is wrong, we start to get scar tissue. The opposite of scar tissue is regeneration. Regeneration happens when the signal is right. So the wrong signal means the body is not healing either at all or is not healing properly, and it's either going to not heal or it's going to heal with scar tissue that's going to make things not work very well. In the spine, when there's even a micro trauma that affects the spine, what happens is the soft tissue around the spine initially becomes like chewed up bubble gum. Have you ever walked down the sidewalk and stepped in bubble gum and then you felt the resistance on your shoe? You could still walk, you could still run, but there's resistance. It's not happening smoothly. Well, the same is true in the body. When there's a micro trauma, the soft tissue around the spine starts to become kind of like this pliable, gummy sort of tissue. And it can still be healed and repaired at that stage. But eventually, and not very long after, so 14 days after a micro trauma, that starts to convert into what's like a burn victim skin. Have you ever seen a burn victim skin? It can be black, it can be purple, but it's completely ineffective. It's not useful anymore. And in fact, in the hospital, they'll have to remove that damaged tissue and do a skin graft to replace it because that tissue doesn't work anymore. 14 days after a micro trauma, according to Dr. Tapio Vitamin out of Helsinki, Finland, originally. I think he's in Canada now. But he talked about how 14 days after a micro trauma, he says 7 to 14 days, but 14 is more accurate. I would get it addressed sooner, for sure. But That's when scar tissue, that burn victim skin, starts to permanently be embedded into the spine. That creates an instability, and now there's abnormal motion, and now that's where we start to get that degenerative breakdown around the spine, that what leads to degenerative disc disease. So when this signal is wrong, the scar tissue is what forms. But regeneration happens when the signal is right. And so the question is, how do we get that signal right? Well, we've got technology. It's called soft wave TRT, tissue regenerative technology, one of the most phenomenal technologies I've ever seen. The results are outstanding. We've got people after one session that can walk up and down stairs that were having knee trouble. It's great for plantar fasciitis. We use this very extensively in situations where people are dealing with peripheral neuropathy that they were told was not reversible, yet we see it reverse every day. No joke. It wouldn't be fair or ethical for me to tell you that if it wasn't true. So we're seeing incredible results with that. We've got people who couldn't move their shoulders and were told they had to have surgery and they had to have reverse shoulder replacements, and they've got movement back into their shoulder. We've got people who had low back and hip trouble that wasn't responding to anything else, and it responded to soft wave because it's starting to correct the body's regenerative breakdown. It's initiating stem cell production in that area, and it's allowing the body, instead of breaking down, to actually start building back up. We have professional musicians whose hands weren't working because of trigger finger that got amazing corrective results with this technology. We have people who were not able to bend their head from side to side, and after one session they were able to bend their head. It wasn't completely fixed in one session, but it's so fast once we get the body starting to work how it was designed to work. And here's the other thing. Think about how you used to heal. And if you're saying things like, I just don't heal like I used to, or I just can't fight those like I used to, or I just don't have the energy like I used to, we know, but we also know what to do with that, because you deserve to heal and function at your best. You deserve to offer the world your God-given potential, your full potential, and the world deserves you at your best. We actually have an ethical and moral responsibility to offer our best selves to the world. But if you're being held back, you're not offering your best self, and our job is to help you with that. Cells don't heal unless they're allowed to. They want to heal, but if the signals are blocked, if they're getting bad intel, bad information, it's a bad game of telephone. The cell phone's breaking up. It's in a dead zone. The body's not going to heal how it needs to. The root cause quiz you can take helps us see whether healing signals are missing or not. Text the word ROOT, R-O-O-T, to our office number, 734-274-5107, to get a link to that free assessment. Or you can click the link in the description below if you're watching this online. This is the Dr. Lazar Show. Thanks for sticking with us. We're going to take a short break, and when we come back, we're going to talk about microcirculation and how blood flow is a very, very important missing key to your healing and functioning journey. I'll be back right after this. Welcome back to the Dr. Lazar Show. We've been talking so far about how the root cause is what we have to address in the body, and how we have an assessment that can help you determine whether you're addressing the root cause or not. Although if you're not getting lasting results, you're not addressing the root cause, or who you're seeing is not addressing the root cause. This is no indication on you, other than maybe you haven't found the right solution yet. But that's what we're here for. And so in this segment, I want to talk about microcirculation. There's a device called Beamer, B-E-M-E-R. No, it's not the automobile, although those are cool too. But microcirculation is huge. If we think about what microcirculation means, we have large vessels in the body, and then smaller, and then smaller, and then smaller vessels. And the smallest vessels are called capillaries. And capillaries are the tiny vessels where exchange happens. So nutrients and oxygen are passed from the blood through the capillaries into the cells, and the waste from the cells are picked back up in the capillaries and carried out to be addressed, to be, gotten rid of. The garbage man picks up the cellular waste at the capillaries. That's kind of how to think about it. If we cut off the blood flow to a certain area of the body completely, that part of the body is going to die. You have to have it cut off or it'll affect the rest of the body. So we know inherently, we know that blood flow is important, but what are we doing about it? Chronic stress and aging beat up those tiny blood vessels. That's why we look different as we age. I've heard it said so many times, look at somebody when they take over the presidency of the United States and look at them 4 years later. Their hair is gray, their face is more wrinkly. Chronic stress beats up those tiny blood vessels. And all the exercise in the world, while it's very important to be exercising, all the exercise in the world is not going to help repair those tiny blood vessels. There needs to be work done specifically on those. That's where Beamer comes in. There's a patented signal that goes into the body that causes, specifically, it causes a smooth muscle contraction before and after those capillary beds, so it's pushing more blood through there. And what that means is about 30% more oxygen in your blood. Now think about this. Cancer and inflammation cannot hang out with oxygen. So oxygen is the boss. When we have more oxygen, that's why that's so effective. That's why people go for hyperbaric oxygen therapy, which is very effective, although this is more effective than that on an order of 4 times more oxygen in the blood. And you don't have to go in for sessions. It's actually a device you purchase to use at home. You can come in for sessions, but it's more cost effective in the long run to do it at home. It's also why people get hydrogen peroxide. They'll get peroxide injections and infusions because hydrogen peroxide has an additional oxygen molecule than water. So water is H2O, so 2 hydrogen molecules, 1 oxygen molecule. And then hydrogen peroxide is H2O2. There's an additional oxygen molecule on there. Also very effective. But we can tutor the body, if you will, to do what it needs to do by improving microcirculation. Now look, we've talked about alignment. Alignment matters. We've talked about cellular signaling. That matters. But nothing heals without nerve flow, and nothing heals without blood flow. And this specifically is about blood flow. Oxygen in, waste out. That's huge. And healing speed determines outcomes. If it takes forever to heal, that's not very effective. The key is when there's trouble, we want to heal very, very quickly. Otherwise, we get bogged down and then held up, and now our body's laying on compensation after compensation. So nothing heals without blood flow. That's a huge, huge important factor. If recovery to you feels slow or stalled, if you feel like you're not healing as quickly as you used to, text the word ROOT, R-O-O-T, to 734-274-5107, or click the link in the description below if you're watching online, and take our root cause assessment. It's absolutely free to you, and it will help you determine where you should focus, who you should ask for help from, if there are certain types of technologies that might help you. It's free. It's yours to take and use how you'd like, but that's a way we can serve you whether you're close to our office or not. This is the Dr. Lazar Show. I'm going to take a short break. I'll be back right after this. Welcome back to the Dr. Lazar Show. We're talking about how getting to the root cause and using the right technology are the missing keys to our health, healing, recovery, longevity, vitalism. We've all been called here for something. And if you're being held back because your body's not moving properly, or your nervous system isn't communicating properly, or your body's not healing fast enough or healing properly at all, your resistance is down and your stress levels are high. How do we get the body to adapt better? And the key to that is everything we're talking about here. The nervous system is the major controller of the body. So we need to start with that. And when the nervous system breaks down, bad things happen. Neuropathy is an example of that. Now, if you're ever dealing with peripheral neuropathy, it is so, so common. We've seen a huge uptick of that over the last couple of years. And people get part of it. They're told that neuropathy is just that nerves are kind of failing and it's far away from the heart. And so as you age, your hands and feet, your feet are the furthest, but the further away you get from the heart, the worse things are. And then they just kind of break down. But nerves don't just fail randomly. That's not how it works. They fail from a couple different things. One of them can be from compression. If they're being pressed anywhere, either where they leave the spine or anywhere between the spine and the feet, nerve compression can cause neuropathy. Nerves also fail from poor circulation. So blood flow is an issue. So compression on nerves makes the nerve flow faulty. That can lead to it. Poor circulation can lead to it. Nerves also fail from toxic stress. That's why we see things like chemotherapy-induced neuropathy, medication-induced neuropathy, vaccine-induced neuropathy. So blood flow, nerve flow, and toxic stress are what cause neuropathy. And when those causes are addressed, the function can be restored. So we have a full assessment, we do, for people that are in Southeast Michigan or want to travel here. We have a full assessment where we do infrared imaging. We look at the blood flow into your hands and feet. We do a full neuropathy evaluation and quantify whether or not you're dealing with peripheral neuropathy or not. You can have symptoms of it, but it doesn't necessarily have to be neuropathy. Most of the time, neuropathy is diagnosed just based on symptoms. But there can be a lot of other things. I've seen a lot of people that have been diagnosed with neuropathy that actually had vasculitis. I've seen people with both. So getting the right answer is obviously critical in terms of getting this corrected. But we have a full reversal program. It's 2 parts. One part is in-office care. We have a very specific regimen where we have gotten amazing results for people. We've seen people who were told they were never going to walk again and they were going to have their legs cut off to being able to walk again, walk in the sand, run on the beach again, feel the ocean on their feet again. It's amazing the stuff that happens. And I don't know why people are told nothing can be done. It's simply not true. People are told you can have gabapentin injections, or you can take gabapentin pills. You can have injections, and eventually they can cut your legs off. But there's nothing that can be done. It's just not true. I don't have any other way to say it. It's just not true. There's absolutely stuff that can be done. Now, it's not for everybody. So we test it first, but we can find out whether or not neuropathy can be reversed. And then the second part is we have a proprietary Lazar method neuropathy reversal program where there's a kit that you use at home, very, very specific, very regimented. And the people that do it all over the country, we send our kits all over the country. So you don't have to be here. You don't have to come in for care necessarily. There's a lot of it that can be done at home. We can help with that. Just drop a comment below, or you can call us at the number we've been giving you to text the word root, which is 734-274-5107. That's our office number, and you can call or text us there. But nerve damage is a process. It's not a life sentence. And as long as we can address it, get all hands on deck, and then start pushing that freight train back up the hill, the results we've seen are nothing short of miraculous. If you're dealing with numbness or tingling in your feet, if you feel like you've got marshmallows in your socks, or your socks are bunched up, or you're dealing with burning in your feet, or you just can't feel your feet and steps are hard and curbs are hard and uneven surfaces are hard for you to walk on, we'd love to see if we can get to the root cause of that. Text the word root, ROOT, to 734-274-5107, or you can follow the link in the description below. This is the Dr. Lazar Show, and we're talking about how the body was designed to heal on its own. It wants to heal and function. It just needs to be allowed to do that. And when interference gets in the way, it doesn't work well. Think about if you're on your way somewhere, you've got to go pick something up and you know exactly what you need to do, but then there's a traffic jam. That messes with your ability to do that. And if I came to you and said, why do you not want to go pick this up from the store? And you would say, I do want to pick this up from the store. I'm on my way to picking this up from the store. And I say, no, you must not want to pick this up from the store because you're not at the store yet. And you say, I don't have any control over that. I'm stuck in traffic. That's the same way the body works. It wants to heal. It wants to regulate. It wants to function well. It wants to thrive. If it's not, that doesn't mean that it doesn't want to. It means there's something blocking that, like the traffic jam. That's the best thing I can tell you. If your body is not working the way you want it to work, if it's not feeling the way you want it to feel, if it's not functioning the way you want it to function, it doesn't mean there's something wrong with it necessarily. It usually means there's something blocking that from happening. Because when things are free of interference, the body will heal and regulate on its own. We don't have to make it heal and regulate. We have to remove what's stopping it from healing and regulating. And those are very different. So we talk about the Lazar method a lot. And the bottom line with that is it's unique because we've failed our way forward. We've seen things that we thought would work that didn't. We've had people come in that tried things that we thought might have worked but didn't work before they came in. And we've formulated over time an assessment that's unique, a care delivery model that's unique. And we teach other providers, other doctors, other offices how to do this and things. But the Lazar method is unique in that. And the bottom line is with it is that we don't guess ever. We assess, we measure, we correct, we remeasure, we reassess, and we keep tweaking that until we get the results that you're looking for and that you deserve. And then we support. We support the body in holding that work that's done. Random care produces random results. People say, not to us so much anymore, but earlier in our practice, people would say, I've heard once I start, I have to keep coming. That's really not any more true than the dentist or church or the gym. I mean, you can work out if you want and then stop working out. It doesn't mean the results weren't there when you were working out, but random care produces random results. And so the more consistent you are with anything, with your diet, with your savings, with your prayer life, with exercise, with dating your spouse, the more consistent you are with those, the better your results are going to be. And the more random you are, the more random your results are going to be. So we don't do random care in the office. We have systems because we found that systems heal systems. You've got to follow a systematic process. The root cause quiz is the first step. If you want to know how to zero in on what the root cause to your challenges, your health challenges might be, then take the root cause quiz. It's free. Text the word root, ROOT, to 734-274-5107, or you can follow the link in the description below. It's super helpful to have the information, but it's only as helpful as what you do with it. I'm going to take a short break. I'll be back right after this. Welcome back to the Dr. Lazar Show. It's been a great show so far, and we're talking about real scenarios. We've talked about the posture IQ and how measuring your posture in space lets us know whether this is a problem of global breakdown in your body or whether things are isolated to a specific part of your body. Very, very important to know if your knee problem or back problem or hip problem or neck problem is from that area itself or if it's from somewhere else. Very, very helpful. We've talked about our high intensity laser therapy. We've talked about our soft wave tissue regenerative technology that stimulates stem cells in the body. We've talked about quantum spinal mechanics and our precision adjusting methods that feel like having the pulse taken. There's nothing forceful. Force doesn't work in the body. We've got to use precision and allow the body to function without interference and work with the body. We've talked about microcirculation with the Beamer therapy device. And so we've talked about a lot of things. And I say that so you know there are options. I don't go over all this so you're confused. Certainly that wouldn't be helpful. So here's what I want you to know. This type of protocol, the Lazar method, this type of care, these systems are for certain groups of people, and we're fully aware that it's not for everyone. For example, this type of care is not for people looking for a quick fix. No such thing exists. Now, you should get results early and often, but it's not a quick fix. And so this method is not for people looking for a quick fix. It is for people who want longevity, performance, and function. It's not for people who only want to do what their sick care insurance covers. It's for people who say, I realize that my auto insurance covers if I'm in an accident, but I'm responsible for the maintenance. I'm responsible for my oil changes and tire rotations and wiper blades and fuel. I don't even know about cars, but I'm responsible for the maintenance of it. My insurance company is there if there's a big accident, which I hope there never is. This is for people who are willing to address causes and not just address pain. There's a big difference between feeling better and getting better. The cool thing is, as you get better, you will feel better. But if your goal is just feeling better and temporary fixes, this would not be the right method for you. Think about it this way. Imagine going into the dentist and the dentist does an x-ray and says, you have a small cavity back here in your tooth. And you say, that's weird. It doesn't hurt. And they say, well, great. We found it before it hurt. That's why we do the x-rays. And you said, yeah, just leave it. If it starts hurting, I'll let you know. That doesn't make a whole lot of sense. And the same is true when we're addressing causes, not chasing pain. You can only feel 9% of what your nervous system is doing at any given time. So if you're going based on symptoms, first of all, you're going to miss it 91% of the time. Number two, the symptoms are often not where the problem is. Think about the concept of a fire and a smoke detector. The smoke detector doesn't go off only where the fire is. The fire can be completely on the other side of the house. So where the smoke detector is not an indicator of where the fire is. So for people who are willing to address causes, not just chase pain, people who are looking for correction, not looking for masking symptoms, and there's nothing wrong with those other things. I'm just saying that this type of method is not for people who are looking to mask symptoms. We, of course, want you to feel better, but we want that to come from you getting better. Because the harsh reality is you could take enough medication to knock yourself out and then you wouldn't hurt, at least while you're knocked out. But that doesn't solve anything. And we have to stop looking at pain as the problem. Pain is never the problem. If you could take a pill today and you wouldn't feel pain ever again, would you take it? And initially, if we're in pain, we might think, heck yeah, I will. Give me that. But what if I were to tell you you're going to step on a sharp, rusty nail today and it's going to go through your shoes or through your boots? You're not going to feel any pain, so you're not going to know you did that. And then you're not going to get the help you need. And then you're going to have an infection. And then the infection's going to spread. All because your body's warning system wasn't working. So please stop looking at pain as the problem. Pain is not the problem. Pain is a warning that there is a problem. Appease your inner 3-year-old who wants to know why things are happening. Your nerves are breaking down. Why? Because you're getting older. No, try again. There's compression somewhere. There's lack of blood flow. There's been toxic stress or all the above. But we've got to find it and we've got to fix it. If that sounds like you, text the word root, ROOT, to 734-274-5107 for the root cause assessment. That's free to you. You can also follow the link in the description below if you're watching online. So here's a way I would wrap this up for you. If you're tired of guessing, if you're tired of tons of visits, visit after visit after visit after visit without clear answers, and you're experiencing random acts of treatment where they'll say, take this, try this, see if that helps. If you're tired of managing symptoms, you've heard of pain management. Don't ever manage pain. Fix it. Fix what's causing it. Allow people who know how to find it. Allow us to do that. If you want clarity instead of confusion, you have to start with information. You have to start with the right information. We would love to help you with that. All you have to do is text the word root, ROOT, to 734-274-5107. Save that number because you can call us, you can text us, but text root to that number or follow the link in the description below if you're watching online. Take the quiz, get clarity, get answers, then decide. Thanks for tuning into the Dr. Lazar Show. If you're listening on the radio, thank you so much for tuning in. If you're watching online, thank you very much for that. Please like and subscribe. I hate to ask anything of you. We want this to be a gift to you, and we just want everything for you. The truth is, though, that the more you like and subscribe this and share it, the more people can find it. So we're asking for you to help us help others. We're not asking for you to help us help us. I'm Dr. Lazar. You can get more help at drlazar.com, drlazar.com. And one last time, our number is 734-274-5107. Thanks so much, and we'll see you back here next week.